Hey guys, welcome back to the podcast. I am Amanda.
I'm Laura.
I'm Kendra.
And just another reminder to like and review the podcast so other people can find us. But today we have a special treat. Dr. Sarah Smith is joining us. She's also known as the charting coach and is going to give us some insights on how to make charting less miserable. Yay! She's the host of the Sustainable Clinical Medicine podcast, as well as a practicing rural family physician in Canada. She has a passion for reducing burnout and overwhelm due to the administrative burden of clinical medicine. Praise the Lord. Phew. Thank you for joining us today, Sarah. This is going to help so many listeners.
Yeah, you are most welcome. I'm delighted to be here. Thanks for the invitation.
So, Sarah, if you don't mind, tell us a little bit about you, like your training, tell us your story.
Perfect. I trained in Australia. So I did my university in Western Australia, but then moved to Tamworth, Australia, which is a bigger, smaller country town. So we had a big hospital there. We do internship followed by residency years that aren't in a stream until you choose what you want to be when you grow up. I did know I wanted to be a rural family doctor. So I wanted all my hospital training out of the way before I got into actual general practice. So I did my internship followed by my resident years of compulsory topics and then moved into emergency department for my second baby's birth because 3 p.m. till 11 p.m. shifts was easier for me as a second time mum with a stay-at-home dad. And then the next year I did critical care training because I wasn't quite ready to move into general practice at that point. And I wanted a few more skills under my belt before I moved into general practice. And then after finishing 5 years of full-time general practice as a family, we wanted to go traveling. And so we sold everything and I went back to the emergency department to retrain and did locuming as we traveled around Australia. So I found myself in some corners of the world where I was 400 kilometers from the nearest colleague. And so, at times it was interesting and you wonder why you're doing this. And then after the end of that journey of traveling, I ended up with kind of at a loose end, what do we do next? So we came to Canada for a year, 11 years ago, and I'm doing family medicine plus rural emerge plus inpatients here in rural Alberta.
Wow, that's quite a story. That's awesome. So, where did your journey to coaching physicians and clinicians on charting begin?
Yeah, so I noticed a habit of mine in the general practice world where I would be finished the patients for the day and have a big, finally, all the patients are done moment, and then look at this mountain of work in front of me before I could get home to all the duties of being a parent at home. And so that was painful in itself. And then the answer from my colleagues and mentors and supervisors was, well, you handle that by coming in on Saturday or Sunday to do the paperwork. And even modeled within the emergency department, you'd have the emergency physicians slogging through patient after patient. And then at the end of their shift, they'd find a quiet corner and write it all up. And we'd say, I'm just going to go write it all up. And that was our end of shift wind down, was in front of these charts, wondering how the time went so quickly and now what happened, kind of the wrap up. So that was hours and hours of my evening and weekends of paperwork in after a clinical day. And then I moved country and I moved healthcare system and I moved EMR and different way of seeing patients in the clinic. And I still had this same problem happening, that I was still not done at the end of the day or the end of the shift, hours and hours of time doing the wrap up of the day or the finishing the work of the day, the everything else. And it was becoming unsustainable. But I had no other skill set, no other way to support my family, only income earner in the household. And so I had to figure it out. I didn't have any answers. And I eventually heard of a life coach talking about impossible things becoming possible. And I'm like, but you don't understand this paperwork thing. It's bigger than impossible. I've looked, there is no answers here. And I went looking for a physician coach because I'm like, well, I can't have just any old person help me. It's got to be a doctor, of course.
Right.
And so I looked in the world, and the coaches who were physicians at that time were helping you leave medicine, find a new career, make life better. And as I said, I didn't have any skill sets that would be easily translatable to a different idea at that point that I could imagine. So it went back to the original impossible things are possible. And I'm like, okay, we're going to do this. We're going to create the impossible. We're going to create a day where I can be done at the end of the last patient. I can wrap up and go home, like be done and go home with no homework. The no homework idea was impossibly but enticing enough that I'm like, I'm going to do this, and just step by step until I got to a different place, a different experience of clinical medicine, but seeing the same number of patients and the same workload, the same EMR, the same team I was working with. And then bucket loads of time I created when you finally have no evening and weekend work, that I thought I need to share this with others. So of course I went and did certification, because that's what physicians do, right? We become certified.
Yeah.
How I ended up in the coaching space was, coaching really works. It was amazing for me. I must help my friends. And then I said to the world, well, what do you want help with? And they said the paperwork. I'm like, oh no, I just fixed this problem. Now I've got to dive back in because everybody else is having the same problem. Oh, okay. All right. Well, fine. I'll do that then. So that's what I did. I started helping physicians one-on-one initially, and now within a group program, to just figure out, how do we create a day where we can get the work of the day done too. Yeah.
I love that. I love that. Well, kudos to you to figuring it out, because so many of us are taking work home or staying over for hours finishing their charting. And like when you said that the answer was go to work on Saturday and Sunday, or like going in on days off, like my stomach just dropped. I'm like, oh no, that is not the answer. So those of us who are doing so much charting at home and not being paid for it, by the way, what are we doing wrong?
Yeah, I think that's a difficult question, because that implies that you're doing it wrong. But I think what you're doing is you're doing it like you were taught to, or you're doing it like everybody else is, or you're doing it without having had any training in a different way. And so these are skills that we can learn even within the busyness that we find ourselves right now, right? So even though I'm in rural Alberta, I'm not adverse to the fact that we have pretty much double the number of patients coming through our doors now than we did before. And not with easy things, of course, it's an emergency department, but even within the clinical environment of the clinic and outpatients, these same principles can apply as well. So if you're thinking about you, Laura, in your emergency department day or in your clinical day, and you've just given everything within that shift hours and you're exhausted and you're done, okay? And now we're saying, and by the way, here, have this second job, which won't pay you anything, of the pieces that you don't enjoy, and do that instead of resting well. And then see how much you want to come back tomorrow. So this isn't just a me problem. This is an us problem. Because if our colleagues are going to come and give everything they've got, they haven't peed, they haven't had enough fluid, they haven't eaten enough, they haven't rested, they see the nurses going to and from their breaks, and you get to the end and you're just physically and mentally exhausted. And then you go and add 2, 4, 6 hours of cleanup at the end of that shift. How likely are we to have our colleagues coming back if they're doing that? And when we think about it as that step back and say, what if we all decided that the documentation's also important enough that we try and guard that with some preciousness too within that shift, so that when Laura gets to go home, you're done and you're just out the door and you go and rest well, young lady. Eat, sleep, drink water, have hugs, go for a ride, go to the gym, whatever it is that you want to do, so that you come back your best self next time. And so when we've talked,
I love that.
Yeah, we've talked to departments, it's not just the you, it's the us. We start looking at what it is getting in the way of seeing the patient and getting that documentation done. So within the foundational principles of how I help physicians, we say, see the patient, do the chart, so that the work of this is done and everything that you're doing is complete behind you. So you're not adding things to the undone stuff behind you that has to be cleaned up at the end. Well, in the emergency department, of course, you see a patient, you hear the story, you examine them, you decide what tests you want, and then you move on to the next one. Or you're halfway through that, but you get pulled out to the next thing, and then you have to go back. Or that information comes in, and now your diagnostic reasoning's happening. You're putting all of that together. You're coming up with, what do I think's going on? What do I want to do next with this person? How do we help them get out of here or move to the next place that they need care? So how do we document that? And so we say, as you're seeing the patient, document to this point. It's half done. You know that. You don't even know what you're dealing with yet, potentially. You're just going to put a few things in and say, what's going on? I don't know. But having given yourself a trail of what's happening to this point, each time you're seeing them, is going to create for you this work is complete as you go. And then starting to notice what gets in the way of that. How will you do that within your department? What does that look like for you? How and where can you get that work done? Which is a pretty important question about where.
Yes. I will say too, if you, I don't know, working in the emergency department definitely does not make it easier to focus. And if you wait till the end, sometimes that history of present illness is just gone. Like if you have not taken the moment, like you said, to just put it in, like, yeah, I have no idea. I don't remember this person.
The other weird thing about the emergency department is that there's like old lady chest pain day, so that they're all the same. You know what I mean? Or it's broken hip day, and you're like, wait, which one? Which one was it? So it is important to stay caught up.
Yeah. And so as we start to do this work, it's different. It's a different workflow. You're starting to be curious about, how will I document this? What is going to be the first way I try? Not my way. I may not find the best way the first time. This is about, what else could I do to look after me too and us too? Not just me too. It's us too. So it helps you and your team as things are happening with that patient care. You're getting those documents done too. And yes, of course, you have bleeding, crowning, coding, seizing, things that will actually require you to be eyes on and hands on for a moment, but you get a moment. Once you get a moment, dump it out. Start to just get that workflow a little different, so that at least some of the day to start with starts looking different to how it looks right now. And then we're starting to notice everything else that happens. It's not just the patients and the documentation. It's I've done the ECG on room 5. By the way, I've got a kid, blah, blah, blah. Whatever those interruptions are, they matter, because each time your focus is taken off what you're doing, you're having that decision fatigue of turning your attention to something else and turning, what was I doing? Where was I going? Oh, I put, that ring block in. It should be working by now. How do we keep those things going that we're doing when we've got multiple things happening at one time? So we start having team discussions. What are the types of interruptions that we're noticing? Who comes and asks us, and what do they ask us? And how would we prefer to receive that information? How do we start to communicate that to our team? It may not be your everyday team. It might be today's team. When do you want that information? How do you want it delivered to you? Which bits are important and which ones could be left here and I'll see them? There's different ways of doing our work.
Yeah, that's awesome. That is a great perspective for, some of us that can't even get one sentence of the HPI out, and, homeboys rolling down the gurney and we need a doctor in here, and so much for that. But just knowing that the perspective of having a pause, like even if gunshot wound guy's rolling down the thing and they need a doctor, you go in there and then you come back. I mean, there is always some break or a pause. So there is pause, and there is a way to redeem that little bit of time, even if it includes a deep breath. I mean, I love that when you say, like, we need to rest, because even a rest could be like a couple of deep breaths just to reset, right? And just to allow your brain to kind of clear the chaos. So, but I love these first steps that you've had to consider a new perspective when looking at the work. What are some more advanced steps?
Advanced steps can look different for different people in different environments. So some people will have scribes, some will be dictating, some will be typing, some will have computers on wheels in the rooms, others will not. So start looking at your environment, that big step back and saying, what is left at the end of the day? And when I open that chart, it's blank. Okay, interesting. How can I start to be more mindful of myself as I go into a new patient room or into a new shift to say, how can I start to leave myself information here when I don't necessarily have access to all the things that every other type of human has within their emergency departments? So it's the how and where could I do this work if I wanted to create a new way? What is it that I'm looking to create for myself? How many hours are you there at the end and why? And what sorts of things are creating that? And how could we have made some inkling into that earlier in the shift? They can be different ways of attacking this process. Even the length of time you're in the room can matter. The way you set up and talk to your patients, the ways you're taking your history, the ways you're doing your exam, the process you take to get there looks different for each of us. Interesting. And so as you step back and say, okay, well, how long was I in there for? Is that a reasonable amount of time, or what could I have done differently? That problem solving, we do that all the time in emergency medicine. We look at the worst case scenarios and we say, how could I have turned up differently? How could we have run that differently? It's just taking that very well practiced problem solving and turning it to other areas, not within the busyness of your shift necessarily, but when you're taking a shower in a few days or going for a walk, somewhere where you're starting to just process the how's this going and how else could it go if I knew I was open to new possibilities for my emergency shifts.
So time is one of our most valuable assets. Do you have any tips, even non-chart relating tips? You kind of alluded to that by processing outside of the shift, like later on. So that's a real good one.
Yeah. So time saving, things like towards the middle or end of shift, you might kind of notice you haven't had much to drink or eat. Forgetting our human physiology is really important, that we're more mindful of looking after ourselves too. And so it can be as simple as starting that culture within your department. When you show up for your shift, you kind of look at the people around you and say, hey, who hasn't had water, food, sustenance, a break for the last few hours? Do you need to go right now? What is it that I can do for you so you can go get that for yourself? Pocket snacks, thinking ahead of time. How do I nourish myself while I'm doing this work? Where can I put my water bottle that I'll remember that I need to drink? These types of cueing for us. I know that when I was working, I started working with a sleep coach, which was really helpful because the getting to sleep, staying asleep piece was for myself becoming difficult. So I worked with a sleep coach and got hours of my life back, which was amazing. One of the things we did was that breathing work, Kendra, that you were talking about, that ability to calm down that vibration of there's still a waiting room full of people and I've got every room full, right? That buzzing that's happening within your body that feels very anxious, overwhelming, whatever it is you're experiencing within your day. And you pick up the phone to talk to a consult, right? I'm rural. My nearest big department is 2 hours away. So I have to pick up the phone and talk to people a lot. That picking up the phone to talk to someone is an opportunity to do some of that physiology calming down work. You can do mini micro relaxation work on the phone to a specialist in the city. Fascinating. Never knew this. Wish I had decades ago. So I can deep breath. I can drop my shoulders. I can remind myself you can't be in more than one place at once, right? It can be simple like that. You can put your feet on the floor. One of my favorite things to do, if I get a minute at 2 a.m. when I'm very tired, is I'll just take my shoes off for 5 minutes and just take them on the floor. Yes, it's an emergency department. It's not the nicest place in the world, but feet off, shoes off is like, feels like I've had a whole rest and I haven't, but it's just like, whew, I needed that, and then put them back on and off you run again. But it's those reminding that oh yeah, I'm really feeling overwhelmed by all of this. How can I bring that down a notch? Because that can give you some space as well. Even that, what is going on with this patient? I don't know. It's like, take a minute, pause, and just start to put this together. That high level, expert level thinking can give you back so much time when you say, I need a moment to just, and it's just internal. You might say it externally, but it's that I need a moment to really, what is going on with this person? Right. And just taking that moment to go through that story and say, I know my next step. I may not know what's going on, but I know my next step. Yeah.
Love it. I'm already imagining people listening that are like, no, but you don't understand. The emergency department's busy and there's patients that haven't been signed up for. That's one I've personally heard. And I know what I told him, but I don't know what you would tell him. And the same for like a really busy, like pediatrician or somebody who really has 20 patients in a half day. How are they supposed to stay caught up? Like what sorts of, are there tricks for that?
So thinking about the alternative. So you go to the next room, you go to the next room, you go to the next room, and you say, I'll do that later. I'll do that later. I'll do that later. Okay. Because this is the very well practiced, right?
Mm-hmm.
I'll do that later. I'll just go into the next room and I'll put all that down later. So in the moment, it's very uncomfortable to let somebody wait even another second. And how delighted are you with your 5 p.m. you or end of shift you when you're like, oh, no, now I've got to do all of that work that I left for my later self. And later self is now 5 hours later. She's very hungry. She's very tired. Her brain is exhausted. She's mentally and physically exhausted. And it's not easy to do that work in that moment when you are so fatigued. So how can we start to do more of it in real time and just looking at your ways? There are so many possibilities here. It can be, can we write a little bit more down in the room? If we write a little, can we write a little bit more? A few extra sentences. And so we've had physicians take 6 hours of time back at the end of their shift by starting to be curious about, can I see this patient and just dump that bit out into the document so it's done, and then move on to the next one and do that, and move on to the next one and do that. And then seeing the same number of patients or more and getting home 6 hours earlier.
My experience with waiting till the end is that, sorry, I didn't mean to talk over you, Laura, but when I wait till the end and I relax, then I become really inefficient. Like there's no time deadline. So then it's really easy for me to just drag it out. And it almost sounds like what you have to do is establish some sort of boundary. Like we've had one emergency client that was like, not every patient is coding. Yes, I'm going to have to sometimes get out of order whenever somebody's coding. But unless that's happening, my boundary is I won't get more than 2 charts behind or something like that. It sounds like that's kind of what you have to do.
Or, oh, I noticed that I didn't do any documentation for the last 2. That's okay. I can do this imperfectly, but this next one, okay, let's try again. Okay. So it's like, awareness. Oh yeah, I've slipped into my old ways. Of course you have. You've been doing it this way for decades.
I was just going to say, I love how you were pointing out that, because this is exactly how my mind worked, where I didn't want anyone to have to wait. And I had that discomfort of seeing the patients not being signed up for. But you point out that it's like those people maybe wait a few more moments. And by not making that happen, we're making ourselves like lose our lives. Really, if you're sitting after shift 6 hours and you have nothing outside of work left, is it worth not making those people wait just a few moments to like sacrifice your whole evening? I just really love that perspective you lent there.
Yeah.
Well, another question is for people who feel like they need to document everything. Like, how do you, like CYA kind of stuff? Like, there's no way that you can document 15 pages on every patient and be finished at the end of the day. Is there advice for that?
Yeah. So the patient in front of you, the information that you're getting from that patient, the most timely time to write it down to get the best accuracy is right now. Okay. If you try and push it into your working memory, which you have a very big working memory, and you know that because you've just kept how many patients in your brain all day so you can write it down at the end, right? But it starts to get a bit fuzzy. And so now you're like, but I need to remember all the details. So write them down right now. Okay. So decide, how am I going to do that? Will I decide on a template that will work for me? Will I dictate it? Will I write it in real time as I see the patient? Will I try a few ways and see which is my best way? But if you are someone who is detail orientated, you're going to lose your details as you get further and further into the number of patients you're seeing for the day. By the end of day, you are struggling for all of those details. And so you're trying to pull them all out. So now you go diving into the chart to find all of the things that somebody else might have documented. You're like, oh yeah, that's right. So it's that, how can I just take a load off me so I can still increase the capacity of my clinical brain, my expert level clinical reasoning brain? If I chalk it up with all these little details, I'm not giving my patients that ability to do that multitasking that we have to do about their diagnosis and their symptoms and their physical exam and all of those pieces. So you get to put in your charts whatever you want. If you want to write 15 pages, go for it. Just know there's going to be a time cost for that. And if you're going to do that at the end of the day, do you want to do that? And just being curious, what is a middle ground here that I could start to look at that could be okay for me, right? So I'm not saying you have to do it this or that way. You're the boss about the way you look after your patients, the way you do your charting. And then as you think, I'll just leave that for later because I'll be better at it then, you're not. You're more tired. You're very fatigued and you need to go home and rest.
Okay, I need to know, do some people just hire their own scribe if their hospital system won't?
Most hospital systems let you bring your own scribes in, actually.
Oh, really?
It's not part of union, right? So it's not something that most people would be able to achieve. I've heard of it rarely for some of my colleagues, like certainly not locally. There's been like a couple of instances where people have purchased their own scribes. But I mean, that's something that you might decide that you need, but it's probably going to be a negotiation. I mean, scribes within like a clinical practice aren't necessarily going to be your answer because you have to onboard that person. They have to know how to document your way. You still have to put in all your orders and all of everything else is like, this is the new AI is coming out as well to help with charting. It's still not necessarily solving the problem because you've got the possibility of, when does that chart get done? So you can review it and sign off on it. Now you've got a new work list, right? Because now you've got to review what they did and decide if it's okay. If you don't do that in the moment, now you're doing the editing. So you're not teaching them. So it's another piece. So it could be a good tool for your toolbox, or it might not be your way. Okay. So for me personally, I don't want a scribe because I'm just as fast to do it myself. And I know it's done my way the first time. Scribes can be very helpful in some context they're being given to physicians. It's that idea of how do you use them, onboard them? What are the expectations? What's the discussion we're having with them that says, as I leave the room, you should be where I'm at, right? Mm-hmm. Not, I now finished writing that up for the next 10 minutes and then I'll show you what I did because I'm too busy for that. I've moved on. I can't even remember that person anymore. Like, stop. So it's that as we go in the room, you're going to start. And as I finish up in the room, you should be at that point with me.
Okay. Well, I'm sure there's tons more tips and tricks that you have. So how does somebody listening who wants to get in touch, do they email you? Do they follow you on socials? What's the best way?
Yeah, so they can find me at chartingcoach.ca. So that's where you'll find most of the information about what I do. On Instagram or on Facebook, it's Charting Coach. And Sustainable Clinical Medicine is the podcast that I have.
Very nice. And any last thoughts before we close out?
Okay. So maybe before, at the end of shift, we were looking to deliver to our colleagues an empty waiting room. right? That might have been our previous expectation of ourselves. I think that knowing that we can pivot, and we did so much pivoting through COVID, so we know that we can do change, that it is still available to you, that change is possible and a different clinical experience is possible even for you within the busyness of the place that you work. So if we are deciding that you want to create a more sustainable clinical experience for yourself without much of anything externally changing, it is possible. So just keeping that little nugget alive that if I want to create different, I can. And I can do that my way. And we're just looking for, we don't know your specific way. There's an obstacle course in front of you. And those skills are teachable, trainable, and learnable, just like everything else you did in medicine. So we can do that for you too within the administrative part of your day.
Awesome. Thank you so much, Sarah, for joining us today. Such great wisdom, and just, I love the few new perspectives that you put out there. It is painful to chart, and so it's a problem. So let's solve it, and let's get curious about the ways that it works for you. So thank you for your work and being a pioneer in this field. And if you've joined us today, we recently launched our Wellness 911 program version 2.0. So it has been revamped, and it's better than ever. So go to www.thewholephysician.com to get more information. We take demoralized doctors from fried to fantastic with our easy and evidence-based Wellness 911 program. So until next time, you are whole, you are a gift to medicine, and the work you do matters.